Hello friends, welcome to the healthcare today. Today we'll speak about allergy and asthma. Many times once a patient visits my OPD, when I say that you are having asthma, the patient gives an expression that what are you saying? So in reality, is asthma a bigger disease or allergy a bigger disease? In reality, when we speak about allergy and asthma, how do you differentiate them? So allergy is a broad spectrum of disease where depending upon the involvement of your organ, we categorize the allergic potential. For example, if you're having skin allergy, we call it allergic dermatitis. If you have throat allergy, we call it allergic pharyngitis. If you have tonsillar allergy, we call it allergic tonsillitis. If your nose is completely running, we call it allergic rhinitis. Similarly, eyes, we call it allergic conjunctivitis. So allergy is a large group of disease in which the lung allergy, which is called allergic bronchitis, or also called asthma. Asthma is a small part of total allergy group. So asthma is a relatively smaller disease when you compare with other allergies. So when we speak about asthma, the astonishing fact is around 90% of the patient doesn't even know that they are suffering from asthma. So when they come to my OPD, when I say that you are having asthma, this is the common expression they say that I don't know that I am having asthma, I don't have those severe symptoms. Because patient's perception is that asthma is a dreadful disease. It is not the case. 90% of asthmatics are very mild disease. They have symptoms only when there is change of weather. Many times the patient take anti-allergics and follow some home remedies. The patient improves on his own. So they require medicines for only 1 to 2 weeks. So around 5 to 7% of patients who are called moderate asthmatics, they require inhalers and other supportive therapy, anti-allergic medicines for the entire part of the winter. There are only 3 to 4% of patients who are called severe asthmatics who require inhaler round the clock. These patients, in spite of giving inhaler, they require at times oral steroids. In spite of giving oral steroids also, these patients doesn't improve. So these patients sometimes land up in emergency. They go on to ventilator due to severe exacerbation. So the whole intention of explaining this asthma in this video is only 3% of asthmatic patients will require inhalers for lifelong. Rest of the 97% patients doesn't require inhaler. Depending upon your usage, we step up the inhaler dose. If you are feeling better, we step down the therapy as well. So when we speak about severe asthma, so we have inhalers as an option, we have oral steroids as an option. Now these days we have monoclonal antibodies, they are the targeted therapy. So especially if your asthma is due to increased eosinophils, we have anti-eosinophilic injections available with us. If your asthma due to atopy, for example, atopy is measured by measuring your blood IgE levels. If your IgE levels are more, we give you other monoclonal antibody. So with these injections, most of the severe asthmatics, they are very well controlled. So even in severe asthma, there is nothing to panic in this modern era. We have injections to treat everything. So whenever we start you on inhaler, it is always imperative on the doctor to understand why we are giving you inhaler. He will make you understand why the inhaler is better than oral medication, because it is directly acting, it is low dose, and it gives better results. Once you have improved, we can always decrease the dose and try to stop your inhaler. But inhalers are an essential part of asthma treatment. So once we start you on treatment, we explain you how to avoid your allergens, because unless you get in contact with an allergen, you will not have asthmatic symptoms. So for example, if you notice that you have a seafood and you have an allergy, that means it is understandable that you should not have seafood in next part of your life. So avoidance is an important part of asthma treatment or allergy treatment. Once we know that there is particular allergy which can be treated, we can always use something called desensitization. But these treatments are very costly, so we always advise the patients to take their medications regularly, avoid their allergens, and also take regular vaccinations. We care about you.